Well, thank you everybody for joining today's Lunch and Learn, the last of 2020. And as I've been saying every chance I get, Rita is going to be retiring. She continues to tell me, yes, she will here. So are you counting down the days and the minutes? Thumbs up. So as always, Rita, thank you from all of us at the Chamber and all of our members, the puppies, everybody. Thank you for all your years of service to the Chamber and our membership. And yeah, I still have you on speed dial. So you can retire, but you can't hide. And we'd like to welcome Kim Euler to our staff. She's over there on mine. She's up there in the right corner. So welcome, Kim. And also new to our staff is Nora Stafford, who's on the call. So thank you guys for attending. And in all sincerity, Rita, thank you from the bottom of my heart with everything that you've done, keeping me in line. I know I'm not easy to get along with sometimes. Anyway.
Thanks, Jack. I appreciate it.
Well, no, it's been a pleasure and a lot of fun. So, and you want a puppy? Anyway, I told my wife Sheree to bring our a couple of our German Shepherd puppies up here. So, with that, I also want to thank TPK for sponsoring our Lunch and Learns and the virtual. Are you taking them away? Yeah. All right. Say bye-bye. We'll be, launching into next year, hopefully, as we are rolling out, not we, but as vaccinations get rolled out, we will hopefully be able to do these in person at some point. So we'll stay tuned for a lot of pivoting that we'll do, because as soon as we can, we will meet in person. Let's see, all of our upcoming events, things of that nature, and information, go to durangobusiness.org. If you want to give help or need help, swcoda.org stands for Southwest Colorado Disaster Assistance. It's a great website. And I would like to announce the city and county have put out their second phase of business assistance. So if you go to durangogov.org, and on the homepage, there's the business relief program, and you can click on that and fill out all the information and request information and fill out the forms, get up to $15,000. Also, I know the city's looking at water, sewer, trash, and recycling relief, so to speak. If you have had a decrease of at least 25% or more in revenue, which I'm sure most of us have this year, then you can apply and have those fees waived. I think it's up to either 4 or 5 months. So again, that's on the city's website, durangogov.org. So with that, I will introduce George Glass with Mountain Hyperbarics, and really appreciate you being here. I know that you have, I think I need to come in and probably do it to just have a little bit of some downtime, some mental floss, as I say, and help do some recovery. So I'm anxious to hear what you're up to over at Mountain Hyperbarics. And with that, George, welcome, and thank you for being at Lunch and Learn. I'll turn it over to you.
All right, thanks so much, Jack. I appreciate it. And as we were speaking about before everybody jumped on, I am very low tech, so I will be sharing quite a bit of information during this session. But if anybody would like, I actually do have, this is Jack's high tech, so I'm going to use his. I do have handouts that I use for these presentations. If anybody would like the information afterwards, you can get your information from Rita and send that out to you. So I am looking around at the names. There's a couple of other people that I'm expecting to come on, including somebody who actually runs a hyperbaric not-for-profit organization back east, who signed up for this. And hi, Gretchen. I hope you can hear us now. So what I'd like to do is to do this presentation. If there's anything that you need clarification on in that, please, stop me on any of the information that I'm going to be presenting today. Otherwise, at the end, I'd really love it if you folks have questions for me, either as a professional wanting to use hyperbarics as a treatment with clients or patients, or you actually have personal questions and that you'd like to ask about what hyperbarics can do for yourself or somebody that you know. So having said that, let's dive in. There's my segue. And, the reason why we say dive and we're diving in is actually hyperbaric sessions are called dive sessions. And the reason for that is hyperbaric oxygen therapy is actually based on dive tables in that. So the chambers that we use in that for hyperbarics and how we use them, they're actually based on dive tables and concepts in diving. So I know that most people have turned off their video and are listening to this, but most people who are divers and those people who are divers, understand the concepts of dive tables, but also the bends. And that was really one of the original reasons why hyperbarics came onto the medical scene, as big as it has been exploding actually for the last century. And, it was used regularly as a preventative or as a treatment for the bends. So all of our sessions are actually called dives. When you come into the clinic, or dive sessions. And initially, I'm actually just going to read what hyperbarics is, so that you get a concept of what it is, what it actually does physiologically, and hopefully my visuals and the little bit of Italian in me showing you what it does physically for people will help with it. So this is the only portion of this whole presentation where I'm actually going to read something to you so that we can establish kind of some groundwork for what this is. So hyperbaric oxygen therapy is the breathing of 100% or enriched oxygen while under increased atmospheric pressure. This greatly increases the partial pressure of oxygen in your system systemically in every cell in the body. So hyperbaric oxygen therapy is not a targeted treatment. It is actually, if you compare it to another treatment, let's just say you had a knee surgery. So you have a knee surgery, you're specifically going in, and let's say it was an anterior cruciate ligament, you had it replaced, and I'm using this as an example because probably half of Durango has had an ACL tear and had reconstructive surgery. So you go in and you have your anterior cruciate ligament replaced, it's very targeted. Hyperbaric oxygen therapy is not a targeted therapy. It actually addresses all the cells in the body. So everything from an epidermal cell, the skin cells on our body, to neurons or brain cells. It's affecting all cells in the body. So in other words, it's not a targeted treatment. It is a fully systemic treatment. So this saturates the blood, plasma, and the tissues. In addition to maximizing oxygen in the blood plasma and the hemoglobin, this promotes the healing and growth in particular areas where blood flow is minimal, compromised, or where cellular function is suboptimal. What does that mean? So what that means is that hyperbaric oxygen therapy actually allows circulation to get in the areas that may have been inflamed previously. And what that does is, to use an example, hyperbaric oxygen therapy is actually used prolifically for wound healing. You'll find hyperbaric clinics in hospitals, in hospital-based clinics. And the reason why they have them in there is Well, of course, because it saves money. So insurance companies love it when it comes to wound healing or infected wounds, because it knocks out infection, and then it expands capillary beds and will actually increase tenfold the healing process. So it reduces hospital stays by virtue of helping a wound to heal 10 times faster than it would if left alone, or just through standard treatment. This has been long known that the healing process in the body cannot take place without appropriate oxygen levels in the tissues. Most illnesses and injuries occur and often linger at a cellular or tissue level. In many cases, such as circulatory problems, non-healing wounds, as we just spoke about, strokes, adequate oxygen cannot reach damaged areas in the body naturally. So hyperbaric oxygen therapy provides this extra oxygen naturally. It's one of the beautiful things about hyperbaric oxygen therapy is it is used as a medical tool. However, it actually is a 100% natural healing process. You're using pressure and oxygen. That's it. It's really, as I tell people when they come in for consultations or I'm talking to them, it's not rocket science. So hyperbaric oxygen therapies improves the quality of life in a patient in many areas when standard medicine is not working. Many conditions such as stroke, cerebral palsy, head injuries, chronic fatigue syndrome, etc., have responded favorably to HBOT. So that's paraphrasing Dr. Paul Harch, who's arguably one of the international, very well-known doctors and has done 40 years of research in hyperbaric oxygen therapy. So to put this in layman's terms for folks out there, see if I can get this in the screen really well and get the Italian go. So basically, this is all hyperbaric oxygen therapy is about. Let's say you knock your head, you have a concussion or a traumatic brain injury, which is a concussion. So you hit your head and there's an inflammatory process that happens in the skull. And that's what creates your headaches, lack of sleep, maybe poor appetite, and a number of other issues that come along with traumatic brain injuries. And of course, where you've been hit influences what the body's response is going to be to that. So you have an inflammatory process that happens, swelling, and the pressure reduces the inflammation. It drops the inflammation level way down. So here's the resultant. When you have an impact injury or another injury that impacts any tissues in the body, then what happens is the inflammatory process, when you reduce the inflammation and hyperoxygenate the hemoglobin, so the blood, you're just oxygenating the blood. Blood's able to get into areas where that inflammatory process used to be, and it helps bring in nutrients. Of course, one of those nutrients is obviously oxygen. Oxygen is incredibly important to the healing process. So it brings that into the area and it will revive cells. So whatever cells we're talking about, whether it's epidermal cells and we're talking about a wound or superficial wound, or we're talking about the neurons again, or the brain cells, it will help to revive those that were essentially, talking about a concussive force in the head and a head injury. You've knocked out brain cells, so to speak. They're not functioning because they're not receiving the nutrients that they need, which includes, most importantly, oxygen. So that's able to get into the area. It revives those cells, and it actually helps to produce additional neurons or brain cells when we're talking about the brain in this injury, an impact injury. The really interesting thing is most recently I have found that through another really well-known doctor and doing some research, I actually found that your neurons or brain cells are not only affected by a concussive force, but it can be a trauma. So we'll use one that we hear of out there and with our veterans, and that PTSD or depression in that actually impacts the neurons and the brain function. So again, it will, in those cases, it is why hyperbarics has been successful in treating people with depression, post-traumatic stress disorder, PTSD, and such. That's why it's actually effective in those cases. Now, a hyperbaric oxygen therapy is not a standalone therapy. It's not a miracle drug. You come in, this is all you do. For treatment, it is incredibly important in these cases that you're combining proper nutrition if you are in the need of talk therapy, and combining with that if you're talking about PTSD and such. So exercise, nutrition, hyperbarics, usually people when they're coming in to see us, they're getting more than one form of therapy at that time. With brain injuries, it's typical that they will have occupational therapy, physical therapy going on at the same time. Hyperbaric simply is a way to actually fast forward the healing process so that people gain ground much faster than they would without it, which is why it's incorporated with the use of traumatic brain injuries in that. And I'm using this as an example also because probably 75% of the patients that we see here, they've had some form of brain injury. So there's my Italian rendition of basically what it does. Pretty simple: reducing inflammation, hyperoxygenating, oxygenating the blood supply that comes into the area and helps the healing process. Not targeted, it's not targeted any particular cells. So it's a full body approach to healing and health. So how does hyperbarics heal? It heals, and this is a little bit of a repeating myself on what we just talked about, but with a little more information in that. Inflammation can act as a barrier for oxygen and healing. Hyperbaric oxygen chambers pressurize oxygen to move into liquid parts of the blood plasma. That's what we just talked about, the reduction of inflammation, hyperoxygenation of the blood and blood plasma so that it infiltrates areas that has not received these incredibly important nutrients to the healing process. So it removes inflammation, hyperoxygenates, and it also is a great way to eliminate if we have toxins in the system. So it actually helps to remove and eliminate chemical toxins. To use an example of that, this past year, we actually treated a veteran who not only had a traumatic brain injury, but had uranium poisoning. And I can use him in this talk because he's kind of our poster child. We did an interview in the not-for-profit we work with, actually posted that interview on their website. So the intention of the treatment really was, in his case, was primarily to remove the uranium toxicity in his system, because if we didn't address that first, his traumatic brain injury, the PTSD that he had, we were treating him for as well, it was not going to be effective unless we addressed the toxicity level. So that's the overview of really, what hyperbaric oxygen therapy is, how it works with the body to heal. So at this point, does anybody have a question for me on, what I've just gone over and giving an overview? I love questions. So if you do. Okay, Jack.
I won't be silent. I'm good at
never.
So a couple questions. One, how long are you in the hyperbaric chamber? Two, how big is the hyperbaric? And what if you're, and I know you get this a lot, the claustrophobic feeling? Walk me through, kind of the process of what someone can, expect with those questions.
That's great, Jack. Thanks so much. You're always good at bringing those questions up. It's why I didn't even put it in the outline I had. So to answer those questions, the hyperbarics, the length of the session depends entirely on what atmospheric pressure that we're using to treat somebody, or even if it's a non-treatment situation where somebody's coming in for general health, maybe they just want to acclimate to elevation and they're trying to preempt the effects of altitude in Durango at 6,500 feet plus. The range and the length of time a session takes is entirely dependent on the pressure, and that's because there's a certain amount of time it takes to pressurize the chamber to the atmospheric pressure we're treating at, and then we're treating for the actual treatment is 60 minutes long, and then there's a decompression that happens at the end of a session. So they vary anywhere from about an hour and 10 minutes in a soft-sided chamber at 1.3 atmospheres to almost 2 hours long at 2.2 atmospheres in our hard-sided medical chamber. It takes almost 2 hours from the time somebody gets in to the time that they get out in decompression. So to answer the second part of the question you asked, Jack, as far as claustrophobia, I've actually never had a problem with claustrophobia. It's because the chambers are a hard-sided chamber that we have in the clinic, mainly for medical treatments. It's really dedicated for that. Is 8 feet long, it's 4 feet in diameter, it has windows in it, it's lit, you can read in there, you can do crossword puzzles, etc. The other chamber, the soft-sided chamber, is 32 inches in diameter. It's about 8 feet long as well. It has windows in it, it's lit. So we don't really have people who experience claustrophobia in the chambers, but it's definitely a question that a lot of people have when they call in. So I think that answered everything you asked, right, Jack?
Yeah. So I guess the other follow-up would be, so can someone come in, you know, I want to say see the chambers, come in and make an appointment, just kind of, I'll say test drive for lack of words, but just, you know, to experience it, I guess, yeah, what is that process, and how far out, you know, go online and book an appointment?
So, you know, the way it works for us anyway, as really being a clinic, is I love it when people call in. We do half-hour free consultations, whether you're getting into the medical chamber or you're really honestly just coming in because you need to acclimate to elevation, or you're doing it for general health reasons. So we really enjoy people doing that. The other option is if anybody feels like they might be claustrophobic, we always invite people to come in and crawl into the chambers when it's not in use, and we close the door and you get to feel what it's going to be like when you're in there. Probably 50% of the people fall asleep while they're in. I don't think the experience of being in there is probably any different than we were talking earlier about SALT 360 and the deprivation chambers that Patty has there. That feeling of relaxation, the comfort and feeling of pressure on your body is like, I explained it like this, it's actually like getting a really nice, tight, squeezing hug, which we could all use right now. Anybody else have a question at this point, or I'll, you know, jump into a little bit of history. All right, I don't see anybody unmuting, so I'll jump into, and the reason why I have a little bit of history in here is because of this. I think a lot of people believe that hyperbarics just suddenly showed up on the medical scene or in healthcare yesterday. And the fact is that hyperbaric oxygen therapy has been around for centuries. We haven't heard about it really mainly until the mid 1950s or so, when it became popularized in the United States. But it actually originated going back to 1662. That's our first knowledge of a hyperbaric chamber. And a hyperbaric chamber back then looked like a huge wine barrel, wooden wine barrel, and they had a huge bellows like you would use to get oxygen and air into a fire, huge bellows, air bellows, and they would pressurize these big wine casks, and they would pressurize it using ambient air, just the air in the room. Versus today, what we do is we're using oxygen. You may have chambers that are actually pressurized with 100% oxygen. Obviously, over the last few hundred years, we become better at what we do, like anything else in the medical world. But it started as far back as 1662. It became really popularized in the usage of it when they were building the Hudson River tunnels. And they used that to actually combat the bends, because divers would go down, they're setting footings for the bridge footings, and the workers were dying. So they created a hyperbaric chamber that they could pull them out and treat them in on site and be able to do their work and go about their work. Then we skip way ahead, so we don't take a lot of time on it. We skip way ahead to 2020. And what I can tell you, and I added to this presentation, is actually brand new information. Israelis actually are at the foremost of this field now and doing research. And the new research and what they have really come up with at this point in time is the concept of angiogenesis. And without getting into the big technical medical terms, angiogenesis is simply the development of new blood vessels. That's what it is. And what they have found is through prolific studies that they're doing is that the hyperbaric oxygen therapy at higher atmospheric pressures actually produces neurocognitive. In other words, it's improving the function of your brain cells, which improves cognition. So we know this even through Alzheimer's studies right now. So that Dr. Hartz that I spoke of earlier, he's actually doing some cutting edge studies with the use of hyperbarics and actually it abating and or improving the decline in Alzheimer's patients. So that's that neurocognitive piece, which is improving the cells in the brain and their function. And then simply what that translates into is better cognitive capacity. And through this, there's what's called neuroplasticity. That, again, is something that's actually pretty simple. It's basically the brains and the neurons, our brain cells, being able to talk to one another. So it improves that connectivity in the brain. And that's what happens with people who have brain injuries of any sort. It starts to reconnect those synapses in your brain, and the neurons can start talking to one another again. And that's where you have cognitive improvement with people that are Alzheimer's patients or traumatic brain injury patients, etc. So it improves the blood flow in the brain. And this clinically improves memory, executive function in the brain, information processing, and just global cognitive scores. And by that, global cognitive scores, I can use an example. We had a patient who came in and we treated very bad brain injury, was doing amazingly well, but did not have motor function to the point where he could do simple finger dexterity exercises like this, and couldn't shift the car, and his test scores had gone way down. By the time we completed the treatment for him, they reported back to us that test scores for him had improved a dramatic 40 points in English and other testing that they had done in school. So baseline testing, and at the end of, actually in the middle of treatment, he was able to do this, which really helped out the occupational therapist who was working with him, who had been working a year to try and get him to do this. and he was able to do that. So there's a fast forwarding of other and helping other healing modalities that somebody might use, whether it's physical therapy, occupational therapy, speech therapy. It helps to improve that neuroconductivity, the brain cells and the function of the brain cells so much faster. Therefore, it makes other people's jobs that much easier. Anybody have any questions about that little segment?
So
Oh yeah, go ahead, Matthew.
Yeah, so you mentioned at the end, like from the beginning to the end of the treatment, how long are the treatments normally? I assume people don't just keep coming forever. You have like a set amount of time?
Yeah, and again, like the time frame in a chamber, it's not exact. So what we do is, when we're doing medical treatments, we're prescribing a certain amount of sessions for it. So I'll use as an example. I'll just use this as an example. And they vary depending on what we're treating. Just like the atmospheric pressures vary depending on what we're treating. A wound is going to be treated at a higher atmospheric pressure than somebody coming in just simply to acclimate to elevation. So I'll use a traumatic brain injury as an example. The baseline treatment for a traumatic brain injury is using 1.5 atmospheres for 40 sessions. Now, it's a continuous treatment. So what we do have is people will come in, and they'll come in 5 days a week as best possible. Life happens. But as best possible 5 days a week until we complete the treatment program. If somebody's looking to compress the treatment program, then we can do what we call double diving. So they might come in the morning, then here's where diving tables come in. Then they have to take a break, an air break, and then they come in the afternoon, and we'll actually dive them a second time in the afternoon. So you compress the treatment time from, in that case, 2 months to 1 month. For a treatment time frame. The reasoning for that, without getting into using all the time to get into these processes, when it comes to traumatic brain injury, skipping forward to 35 to 40 sessions, what we know is through case studies and research and our own experience in the clinic, of course, now too, is that in 35 to 40 sessions is when you have permanent regeneration of the neurons, the brain cells. That's the time frame where the effect of the hyperbaric treatment becomes permanent, and a person will retain 80 to 100% of the effects of the treatment that we've done. Some people may continue on if they still are getting therapeutic benefit. They may continue in treatment, and then we just shorten up the blocks that we're doing and reevaluate as we go along. Are you still getting therapeutic benefit? Are you still getting better? Is your cognitive capacity getting better? Your sleep getting better? General health getting better? And on and on. So it varies, and all the treatments really vary depending on what we're treating, the extent of injury, etc. So does that answer your question, Matthew?
Yeah, thank you. That's amazing that they retain that much of it even after they've stopped doing it. That's cool.
Yeah, and I do check in with patients periodically down the road just to see if they're retaining it. And some of that's really the treatments that are coming out nowadays. Some of it actually is somewhat new. So, and not every case is the same. You can't treat every single person the same. That's just not realistic. Everybody's coming in with a different mixed bag of issues that may affect the treatment program. So, it's day by day when people are coming in for treatment. So thanks for the question. I appreciate it. I love questions. So I wanted to go on to, I'm actually just going to run through really quickly this section. If you want to refer to this information, it's actually on our, it's actually on our website. So you can refer to, you know, what's approved conditions, what insurance will cover, et cetera. So I'm going to go through this section pretty quickly. Again, you can get this information. I can send it to you. I have a very thorough list. Most insurance companies also have this on their website if you look up Hyperbarics. So what's improved and what Medicare will cover at this point in time, or the FDA is approved for treatment, are essentially 14 different pathologies, which include things like gas embolism, decompression sickness that we've talked about, crush injuries from automobile accidents or on-the-job accidents, et cetera. And again, there's 14 different pathologies of which Medicare will cover under those circumstances. It is in a hospital-based setting, and that's why hospitals will have a hyperbaric clinic in there. So I'll say that Mercy has a dedicated, San Juan has a dedicated hyperbaric wound care center, and where they incorporate hyperbarics into the treatment. That's what they do. That's what they specialize in. They actually don't treat anything other than that. Then there's another category which are typically covered by insurance, which can be everything from cancer treatments to burns, recovering from burns, cerebral and pulmonary edema, et cetera. So there's another category of typically covered by insurance. And I'm kind of glossing over this because I don't want to take a huge amount of time and what is covered, what isn't covered by insurance. And getting to this last category, really, this is what we focus on as an independent freestanding clinic, and it's because you can't get it anywhere else. Because insurance won't cover it at this point in time. Although there's a couple of these pathologies which are now in front of the FDA for approval. So we've actually treated autism. We have not treated cerebral palsy, but we can. Stroke, Lyme disease, traumatic brain injuries, multiple sclerosis, Crohn's disease, skin and other infections, spinal cord injuries, migraines, Alzheimer's, peripheral arterial insufficiency, which is obviously the inability for blood to get out to the extremities. You may have neurological symptoms that come with that, peripheral neurology, where you have dead fingers or dead toes. Matter of fact, we have 2 people who are in post chemo treatment, but in treatment for cancer, and they're in a gap now. They're coming in to see us and diving right now in this gap, and they're suffering from issues like that peripheral neurology, where they have numbness or tingling in their fingers and feet. For people who understand and know the cancer drugs and chemo drugs, the other issues that come along with that are things like just the inability to sleep, the fogginess and not being focused, the peripheral issues, digestive issues that come through it. So a lot of cancer treatments, they're incorporating hyperbarics in it because it really helps to mitigate that and those issues. And we have treated that and more. Macular degeneration, very successful in improving people's eyesight in macular degeneration. So it really has a full spectrum. We don't even know what the limits are. We have treated, they're not necessarily on anybody's list, but we've actually treated people with autoimmune diseases, fibromyalgia in management and improving pain. So it just seems to be getting longer, the list of conditions, which is always why I say et cetera, at the end of that. So does anybody have any questions about, what's covered by insurance, what's typically covered, you know, what we might treat in the clinic as a freestanding independent clinic. You know, if you have any specific questions for me now, hey, Gretchen,
George?
I'd love to hear it.
Hey,
Yes.
George, it's Dave Smiley.
Hi, Dave.
Have you treated RA? What is your feeling about RA?
Yeah, we have not. They have found it to be supportive of rheumatoid arthritis, and mainly because of the anti-inflammatory effects of hyperbarics. So it reduces the joint inflammation that comes along with RA. But at this point in time, I can't speak from personal experience. We haven't had anybody specifically with RA come in.
Right.
But you know, it stands to reason that it would be effective, and it's definitely one of the areas that they are studying right now. So that's the thing with hyperbarics. The medical use of it is it's fairly new as far as prolific research, but now the research is actually everywhere. I mean, use a great example of this. Not comedic side effect at all. I was actually looking at what the Israelis were doing for studies, and one of the studies that came up was somebody is actually doing a study, and this makes all the sense in the world, for erectile dysfunction. And I hadn't seen it before ever posted. And I looked at it because I was doing this presentation. I'm like, oh, what's new out there? You know, what are they doing? And of course, it makes all the sense in the world. It reduces inflammation and increases arterial flow.
Right.
Makes all the sense in the world. So yeah, Dave, you know, there's not a lot of data, but I do believe also on our website, I do have a little bit of the research that's been done posted there if you wanted to look at it.
Okay.
But again, physiologically, it makes sense.
Yeah. What
So,
about the general
Yeah.
health? You said for general health. So
Oh yeah.
come in for that, and what does it make them do? Like, what does it make them feel like?
Yeah, so general health, because again, it's not a targeted treatment. It is impacting all the cells in the body. So
Right.
it's improving circulatory flow. It's improving the delivery of nutrients throughout the body. So it just has this general health overview. So as far as like specific instances where people feel certain things when they come out, first of all is it depends on what they're getting in the chamber with, but they may feel really rested or they may feel really energetic. It improves energy levels. So if people are lagging in energy, it helps with that. If people have, which is, and Jack and I were talking about this earlier because he was talking to Access Healthcare. Obviously, depression right now is prolific because of COVID, and we're staying at home and we're not having social interaction. So it is definitely works with, you know, in cases of depression. Matter of fact, there's a clinic that a psychiatrist runs, very well-known doc and psychiatrist, where they're using hyperbarics and without getting into the background of how they're finding what portion of the brain to treat. So they're using hyperbarics and nutrition and exercise, et cetera, to improve people's function. If you improve brain function in general and you heal neurons in general, it will reduce depression levels. So that's why it works with PTSD, as we talked about a little bit earlier. People find that they sleep more deeply and more soundly, which of course is healthy. You know, if they even say for myself, like, I need to get in the chamber now because one of the things that I'm finding is my sleep is disrupted because of, you know, honestly, a little bit of background depressive quality of what's happening in our culture right now or worldwide. So does that answer your question, Dave, or you need a little bit more on that?
Thank you very much. So would you come in like once a week? Like, what would be the regimen for that?
Yeah, so there's where the differentiation occurs. Yeah, you know, I've got people coming in for general health, and they're coming in anywhere from once a week to once a month for a dive. it depends on what your goals are. Always depends on what the goals are of treatment or just of improving general health. Do you need to come in? Do you want to come in once a week? Do you want to come in bi-weekly, once a month? And of course, even with the soft-sided chamber, which we use for general health mainly, you know, we do reduced fee packages for people who are coming in for multiple visits.
Okay.
And that, so does that answer the rest of the question?
Yeah, thank you.
Gretchen, did you have a question for me?
I did have a question. So most of the kind of medical things that you were talking about, the Lyme, the depression, all those things, those are mostly done with treatment in the big chamber, aren't they?
Yes.
Or do you use I guess, so my question is, that was a statement, sorry. My question would be, where do you use your soft-sided chamber most effectively? I'm not very familiar with that chamber.
Yeah, and that's actually a wonderful segue, because what I wanted to get into is actually differentiating between this idea of mild versus medical, or the soft-sided chamber versus the hard-sided chamber. So yeah, thanks for the segue, Gretchen. I appreciate it. So mild versus medical. And this is how I differentiate it. And this is not to say that a soft-sided chamber does not have impact on medical conditions. It does. And as a matter of fact, the people who are coming in, who are in cancer treatments right now, they're getting in the soft-sided chamber. It's not really necessary for them to get in the hard-sided chamber. So the two differences between a soft-sided chamber and a hard-sided chamber are this. A soft-sided chamber can only go up to a maximum, and this is if a chamber is modified, of 1.5 atmospheres. That's where our hard-sided chamber starts for pressure. It goes from 1.5 atmospheres up. So there's a difference in pressure, and it's pretty obvious. You're talking about a soft-sided chamber or a really big bag, as much as I hate to use that as a visual, but it's really a big bag that's inflated, it's vented. The hard-sided chamber, that chamber, you know, can go to the higher atmospheric pressures, and we can also adjust the pressure on the hard-sided chamber, which you can't do on a soft-sided. It stays at, ours is 1.3 atmospheres. The hard-sided chamber, we can adjust from 1.5 to 2.2. So that's one difference between what they call mild or soft-sided and hard-sided or medical. The other difference is in a soft-sided chamber, the oxygen delivery is concentrated oxygen. So it's an oxygen concentrator, same as people might have at home if they're doing supplemental oxygen in that and breathing through a mask or a cannula. The hard-sided chamber, we're using 100% medical grade oxygen in that. That's what's delivered to the patient in that. So those are the two big differences between a soft or mild or a hard or medical chamber. So that starts that off. And even within that spectrum, there's actually even, there's what's called a Ganoff bag. Now, we actually have a company locally, Chinook Medical. They actually developed these Ganoff bags, and they developed it for the military so that you actually had a 15-pound chamber, a bag that you could pack in with a bellows, like the old-fashioned ones I was talking with, the domicilium with the big wine caskets. So they have a foot pump and a bag. It weighs 15 pounds. They use it in a high altitude climbing in case there's an issue with altitude sickness, cerebral edema or pulmonary edema. And in the military, they use it to stabilize the injured on the front line so they can get them to a medical hospital. So that's actually a whole different realm of hyperbarics. rudimentary, so to speak. And then there's one other difference in chambers too, and that is our chambers are monoplace, where you put one person in the chamber. The hard-sided chamber, we can put 2 in. It's big enough. We've actually had both of our kids in that chamber to treat them. And, you know, they sit in there and do their homework. But I can put 2 people in the hard-sided chamber. You can only put 1 person in the soft-sided chamber. That's all that fits in there. But in hospital-based settings, a lot of times you'll find multi-place chambers. So the chamber I got treated on was down in San Antonio, in the hospital there, Swedish hospital down there. They have a chamber that has an antechamber. They can actually seat 12 people in a giant chamber. They all have individual oxygen delivery systems. So you have a multi-place chamber like that. Anybody a Grey's Anatomy fan? So in Grey's Anatomy, there was I forget what season it was, but they actually made a big thing and they installed a huge hyperbaric chamber in the hospital in Seattle Grace. So those are the different types of chambers that are out there. The difference between mild and hard is this too. The mild hyperbaric chambers are FDA approved for acclimating to elevation or altitude sickness. That is the only thing the FDA approves that type of chamber for. Of course, there's other uses as we've spoken of, but that's what's FDA approved. The medical chambers, the list of medical, thanks, Jack. The list of medical conditions that are covered by Medicare or through FDA need to be in a medical grade chamber or they won't be covered. So that's another little difference. The mild chambers we used, as I spoke of, which is general health, enhancing athletic performance. God knows I've done that. Riding the Iron Horse, I get in the chamber 3 days successively before, and my recovery time is like that, just instant. Not bad for an older guy. So it enhances medical performance. You find everybody from LeBron James to other elite athletes, elite cyclists and such are using hyperbaric chambers, the soft-sided chambers. And most of them probably have them in their homes at this point for home use. So soft-sided chambers you can use for home use. And actually the particular model of hard-sided chamber that we have can also be used for home use. It's the only one that can be. So again, I just want to say that you can actually treat some medical conditions in the soft-sided chamber. There just isn't enough information out there to tell you how effective it is, how they're using it. There just isn't enough information. Is it effective? Yes. The person that actually I was talking about with Jack earlier, if I was going to be on this presentation, runs a not-for-profit back in Vermont, and she actually has all soft-sided chambers, and they're treating everything in that. But it's not under doctor's orders. It's not going to be covered by insurance. So there's some gray area in there which needs to be taken into consideration when somebody chooses treatment. So that I bet that answers probably more than all your questions, Gretchen. And I love our conversations I have when you have questions and you call in. So just before I, not COVID. So I have about 4 minutes left. And the last thing I wanted to talk about is just a little bit about where you'll find hyperbarics in the different settings. So I talked about hospital-based clinics and the different types. Monoplaced, Mercy and San Juan have monoplace chambers. Some hospitals have multi-place chambers. You'll find it in a medical setting. There needs to be a doctor's oversight. unless it's covered by insurance, it's extraordinarily expensive. I know that because somebody refers people to me over here because it's too expensive to get the treatment in the hospital. You have freestanding private clinics. That's ours. We're a freestanding private. We will actually treat anything pretty much except for doing wound care because we just don't have the capacity to do the wound care portion. And the other places you'll find it are in a physician's private practice, a chiropractic office, physical therapy offices, spas, and actually veterinary clinics, because they're using it to treat animals now. And they actually have mini versions for small animals, dogs and cats. I've actually seen a dog's life get saved in a hyperbaric chamber, small version of the human-sized chambers. So that's really what I have. That was what I wanted to get to you folks for some basic information on hyperbarics. And I know we just have a couple of minutes left. So does anybody have any questions for me in closing up? Everybody's sufficiently like, that was so much information in 45 minutes. So if anybody doesn't have any questions for me now, again, if you would like me to, I can certainly send this information to you. Be happy to do that. And Jack prompted me to give our website, which is quite simply Mountain Hyperbarics.com. Pretty easy. Lots of information on there. We have a research section on the website. So if you have specific conditions you might want to, you don't want to talk about it here, you can obviously call me and we can do a consult, free half-hour consult. Some of the information is provided through research and interviews of doctors on our website. So that's a great resource. I try and keep it as up-to-date as possible. So you can catch us there. Our phone number is 970-880-4799 in the clinic. So 970-880-4799 or mountainhyperbarics@gmail.com. So I think that's right on the 1 o'clock hour.
George,
So Jack,
thank
you probably want to close this out for the chamber.
Yeah, and again, if anybody would like more information, obviously you can go to mountainhyperbarics.com at the website. Great information there. And then if you'd like, more information, we can connect you with George or, forward the presentation and the talking points that he prepared. So George, thank you so much for today's presentation. And again, I've heard a lot of research from the hyperbarics, and if you're interested, I highly recommend it because I think it can definitely help. And I just like the idea of being able to sleep. Get some rest. Thank you so much. And with that, we'll wrap up today's Lunch and Learn. And thank you, everybody, and be safe and have a great day.
Thank you, everybody. Thanks for your support, Rita, if you're still there, or you can tell her. Oh, no, she's there. Thanks, everyone.